Question 1. Topic: Use of technology in education. A nurse educator is designing an online module for a graduate level course. To ensure effective learning, the educator decides to incorporate interactive elements. Which strategy best supports student engagement and promotes deeper learning in this online environment? A. Posting static PowerPoint slides for students to review independently. B. Embedding interactive case scenarios with branching decision pathways. C. Assigning students to read and summarize chapters from the textbook. D. Providing a discussion forum without guided prompts for student interaction. Answer: B. Embedding interactive case scenarios with branching decision pathways. Explanation: interactive case scenarios with branching decision pathways actively engage learners by requiring critical thinking, decision-making, and application of knowledge. According to constructivist learning theories, learners construct meaning more effectively through interaction and contextual problem-solving. Option A is incorrect because static materials do not engage students interactively or deepen understanding. Option C focuses on passive learning and lacks interactive or applied elements, which limits student engagement. Option D may encourage interaction, but without guided prompts, it lacks structure, making it less effective in fostering meaningful discussions. Relevant guidelines, such as those from the National League for Nursing, NLN, emphasize the importance of leveraging technology to enhance engagement and facilitate active learning. Question 2. Scenario-based. Topic: Mentoring and advising. Dr. Sanchez, a nurse educator, notices that one of her students, Sarah, is consistently underperforming in clinical evaluations despite showing strong theoretical knowledge. Sarah admits she feels overwhelmed in practical settings and struggles to connect theory to practice. What should Dr. Sanchez do to best support Sarah's development? A. Advise Sarah to review her clinical textbooks independently to strengthen her understanding. B. Assign Sarah to observe her peers in the clinical setting without active participation. C. Develop personalized mentoring plan with Sarah, including targeted coaching during clinicals. D. Recommend Sarah consider withdrawing from the program to focus on theory-based roles. Answer: C. Develop a personalized mentoring plan with Sarah, including targeted coaching during clinicals. Explanation: personalized mentoring with targeted coaching directly addresses Sarah's challenges by bridging the gap between theory and practice. Dr. Sanchez can use guided reflection, simulation-based practice, and one-on-one feedback to build Sarah's confidence and skills. Option A fails to address the application of theory in practice, which is Sarah's primary struggle. Option B limits Sarah's active engagement and development of clinical skills. Option D disregards the educator's role in supporting student growth and would be premature decision. This aligns with the NLN core competencies, which highlight mentoring as a critical component of learner development. Question 3. Topic: Leadership in nursing education. A nurse educator is leading a curriculum revision committee. Some team members resist the proposed changes, arguing that the existing curriculum has worked well for years. Which leadership approach is most effective in addressing the resistance and fostering collaboration? A. Authoritatively mandate the changes without further discussion to ensure swift implementation. B. Facilitate open discussions where all members can express their concerns and propose solutions. C. Focus solely on presenting data to prove the superiority of the new curriculum model. D. Avoid addressing the resistance directly to maintain harmony within the team. Answer: B. Facilitate open discussions where all members can express their concerns and propose solutions. Explanation: facilitating open discussions encourages team members to feel heard and valued, fostering collaboration and reducing resistance. This participatory approach aligns with transformational leadership principles, which emphasize shared decision-making and collective ownership of change. Option A risks alienating team members and creating further resistance. Option C may provide evidence but does not address emotional or practical concerns, limiting its effectiveness. Option D avoids the issue and undermines trust, potentially leading to long-term dissatisfaction. This approach adheres to leadership theories, such as Lewin's change management model, which emphasizes unfreezing resistance through communication and engagement. Question 4. Topic: Test construction and analysis. A nurse educator is analyzing the results of a recently administered exam. She notices that a significant number of students chose the same incorrect answer for one of the multiple choice questions. What is the most appropriate step to take in evaluating this test item? A. Disregard the responses and focus on revising future test items. B. Assume that the students lack sufficient preparation for the exam. C. Conduct an item analysis to evaluate the question's validity and potential bias. D. Replace the question with simpler version in subsequent exams. Answer: C. Conduct an item analysis to evaluate the question's validity and potential bias. Explanation: item analysis involves examining the question's difficulty index, discrimination index, and potential flaws in wording or content alignment. If many students select the same incorrect answer, it may indicate ambiguity or poorly constructed question. Option A ignores the opportunity to improve assessment quality. Option B unfairly places blame on students without considering potential flaws in the question. Option D compromises the rigor of future exams by oversimplifying instead of refining. Relevant guidelines from the NLN and OCN emphasize the importance of evidence-based test construction and analysis to ensure fairness and validity. Question 5. Scenario-based topic: cultural competency MS. Patel, a nursing student from India, feels excluded during clinical rotations because her peers frequently discuss topics she finds culturally unfamiliar. She approaches her nurse educator, Dr. Thompson, expressing her discomfort and a desire to feel more included. What is the best course of action for Dr. Thompson? A. Encourage MS. Patel to focus solely on her clinical performance and not worry about peer interactions. B. Facilitate a group discussion to promote cultural awareness and inclusivity among all students. C. Suggest MS. Patel independently research American cultural norms to improve her interactions. D. Pair MS. Patel with another student from a similar cultural background for support. Answer: B. Facilitate a group discussion to promote cultural awareness and inclusivity among all students. Explanation: promoting inclusivity and cultural competence is essential in nursing education. Facilitating a discussion fosters mutual understanding and helps create an inclusive learning environment for all students. Option A disregards MS. Patel's valid concerns and diminishes the importance of cultural inclusivity. Option C places the responsibility solely on MS. Patel rather than addressing the group dynamic. Option D may provide short-term comfort but fails to promote broader cultural integration. The NLN highlights cultural competence as key component in fostering equity and inclusivity in nursing education. Question 6. Topic: active learning techniques. A nurse educator wants to incorporate active learning techniques into a pharmacology course. Which strategy best aligns with the principles of active learning? A. Delivering a detailed lecture followed by a Q&A session. B. Organizing small group activities where students solve clinical case studies. C. Assigning students to memorize drug classifications and mechanisms of action. D. Providing students with detailed handouts summarizing key content. Answer: B. Organizing small group activities where students solve clinical case studies. Explanation: active learning engages students in the learning process through problem solving, collaboration, and critical thinking. Solving clinical case studies in small groups enhances application of knowledge and decision making. Option A is primarily passive, despite the interactive Q&A session. Option C focuses on rote memorization rather than higher order thinking skills. Option D supports learning but does not actively engage students in the process. Active learning strategies align with evidence-based education models emphasizing student-centered approaches. Question 7. Topic: feedback mechanisms. A nurse educator is reviewing student evaluations and notices recurring feedback about unclear expectations in assignments. What is the best strategy to address this issue in future courses? A. Reduce the number of assignments to minimize confusion. B. Provide detailed rubrics that clearly outline expectations and grading criteria. C. Meet with each student individually to discuss their understanding of assignments. D. Allow students to interpret assignment instructions in their own way for flexibility. Answer: B. Provide detailed rubrics that clearly outline expectations and grading criteria. Explanation: detailed rubrics ensure transparency and clarity, guiding students in meeting expectations and reducing ambiguity. Rubrics also promote fairness in grading and align with best practices in formative and summative assessment. Option A avoids addressing the root cause of unclear expectations. Option C is time-intensive and not scalable for large classes. Option D risks inconsistent performance and evaluation outcomes. Assessment guidelines emphasize the importance of clear communication and alignment between learning objectives and evaluation methods. Question 8. Scenario-based. Topic: Leadership in nursing education. Dr. Green, a nurse educator, is tasked with leading a team to integrate interprofessional education (IPE) into the nursing curriculum. Several team members express concern about balancing IPE with existing course requirements. What leadership strategy should Dr. Green employ to successfully implement IPE? A. Mandate the changes and require compliance from all team members. B. Collaborate with the team to identify ways to integrate IPE into existing courses. C. Focus solely on persuading stakeholders of IPE's importance without addressing their concerns. D. Delay implementation until the team feels completely comfortable with the changes. Answer: B. Collaborate with the team to identify ways to integrate IPE into existing courses. Explanation: Collaborative leadership fosters buy-in and ensures that team members actively participate in finding practical solutions. This approach aligns with transformational leadership principles and interprofessional collaboration guidelines. Option A may create resistance and hinder successful implementation. Option C disregards the need to address logistical and structural challenges. Option D postpones progress unnecessarily and misses opportunities for growth. IPE standards from organizations like the Interprofessional Education Collaborative emphasize collaboration, communication, and shared decision-making in curriculum integration. Question 9. Topic: Scholarship and research. Which strategy best demonstrates the nurse educator's engagement in the scholarship of teaching? A. Publishing research on the impact of innovative teaching methods in peer-reviewed journal. B. Conducting informal surveys to gather feedback from students on teaching effectiveness. C. Delivering content-heavy lectures without incorporating student feedback. D. Focusing on clinical expertise rather than engaging in research or scholarship activities. Answer: A. Publishing research on the impact of innovative teaching methods in a peer-reviewed journal. Explanation: Engagement in the scholarship of teaching involves systematic investigation and dissemination of findings to advance nursing education. Publishing peer-reviewed research exemplifies this commitment. Option B is a valuable practice but does not constitute formal scholarship. Option C ignores evidence-based teaching strategies. Option D undervalues the role of academic scholarship in advancing the profession. The NLN encourages nurse educators to contribute to the body of knowledge through research and scholarly activities. Question 10. Topic: Program outcomes and accreditation. A nursing program is preparing for accreditation and must demonstrate that its graduates meet program outcomes. Which approach is most effective for this purpose? A. Surveying alumni to gather anecdotal evidence of their career success. B. Collecting and analyzing data on NCLEX pass rates and employment statistics. C. Providing narrative reports about faculty qualifications and teaching excellence. D. Using student evaluations to showcase satisfaction with the program. Answer: B. Collecting and analyzing data on NCLEX pass rates and employment statistics. Explanation: Accreditation standards require objective evidence of program outcomes such as licensure exam pass rates and employment metrics to demonstrate graduate success. Option A provides subjective data which may not meet accreditation requirements. Option C highlights faculty achievements but does not directly address program outcomes. Option D offers insights into student satisfaction but is insufficient for evaluating graduate performance. Crediting bodies like the CCNE and ASIN emphasize evidence-based evaluation of program outcomes to ensure quality education and accountability. Question 11. Topic: Curriculum design and development. A nurse educator is developing a new course for advanced practice nurses. The educator wants to ensure that the course aligns with both the learning outcomes and professional competencies. What is the most effective way to align the course content with the desired outcomes? A. Base the content solely on the educator's expertise in the field of practice. B. Conduct needs assessment to identify gaps in knowledge and skills, then design the course accordingly. C. Focus only on the latest clinical trends and technological advancements in the field. D. Align the course content with general nursing knowledge without specific professional competencies. Answer: B. Conduct a needs assessment to identify gaps in knowledge and skills, then design the course accordingly. Explanation: Conducting a needs assessment allows the educator to identify specific gaps in knowledge and skills, ensuring that the course is tailored to meet the actual needs of the learners and aligns with professional competencies. This approach is foundational in evidence-based curriculum development. Option A may result in content that is too narrow or not relevant to all students. Option C focuses on trends, but the course should be grounded in competencies and evidence-based practice. Option D risks a lack of specificity and may not meet accreditation or competency standards. Crediting bodies such as the CCNE emphasize the importance of needs assessment in curriculum design to ensure that learning outcomes are relevant and achievable. Question 12. Topic: Mentoring and advising. A nursing student approaches their nurse educator for guidance on balancing academic and personal responsibilities. The student is struggling with time management and feels overwhelmed. What is the most effective strategy for the nurse educator to employ in advising this student? I advise the student to focus solely on academic work, postponing personal matters until after graduation. B. Provide time management resources and offer to meet regularly to monitor progress and offer ongoing support. C. Suggest that the student reduce their course load to alleviate stress. D. Encourage the student to prioritize personal issues and take a break from the nursing program. Answer: B. Provide time management resources and offer to meet regularly to monitor progress and offer ongoing support. Explanation: Effective advising in nursing education includes providing practical resources such as time management tools and offering continuous, personalized support. This approach promotes the student's success both academically and personally, fostering resilience and healthy work-life balance. Option A neglects the importance of addressing the student's personal challenges, which can impact academic success. Option C may not be feasible for all students and does not necessarily address the root cause of the stress. Option D could lead to disengagement from the program, which is not a sustainable solution. Nursing education literature stresses the importance of supportive mentorship and guidance to address the holistic needs of students. Question 13. Scenario-based. Topic: Ethical and legal considerations. Dr. Williams, a nurse educator, learns that one of her students, Sarah, has been repeatedly absent from class due to a personal health condition. Sarah has disclosed the condition but has not requested any accommodations. What should Dr. Williams do next in addressing Sarah's situation? A. Ignore the absences as long as Sarah completes the required assignments. B. Speak with Sarah to offer accommodations and discuss potential support systems available through the school. C. Enforce the attendance policy strictly without considering the underlying cause for the absences. D. Recommend that Sarah withdraw from the course until her health condition improves. Answer: B. Speak with Sarah to offer accommodations and discuss potential support systems available through the school. Explanation: As a nurse educator, it is critical to support students' health and well-being while maintaining academic standards. Offering accommodations, such as extended deadlines or reduced workload, is a reasonable approach to help Sarah succeed while respecting her personal challenges. Option A disregards the student's needs and the possibility of a more supportive solution. Option C may be too rigid and fail to consider individual circumstances that may affect student performance. Option D might be overly burdensome and could discourage the student from continuing in the program. The Americans with Disabilities Act, (ADA), and institutional policies often require educators to provide reasonable accommodations for students dealing with health-related issues. Question 14. Topic: Program evaluation. A nursing program is undergoing a periodic program evaluation to assess the effectiveness of its curriculum and outcomes. Which method should be used to evaluate the long-term impact of the program on graduates' professional performance? A. Administer student satisfaction survey immediately after graduation. B. Conduct focus groups with alumni and employers to gather feedback on graduates' readiness and competence in the workforce. C. Review faculty credentials and their teaching effectiveness in the program. D. Evaluate the course completion rates and grades of current students. Answer: B. Conduct focus groups with alumni and employers to gather feedback on graduates' readiness and competence in the workforce. Explanation: Gathering feedback from alumni and employers provides valuable insights into the long-term effectiveness of the program. This type of evaluation focuses on the real-world application of the curriculum and the preparedness of graduates for professional practice. Option A provides short-term feedback but does not capture long-term career outcomes. Option C focuses on faculty credentials, which are important but do not directly assess program effectiveness. Option D only reflects current student performance and does not provide feedback on graduate outcomes. Program evaluation best practices recommend gathering data on the professional success and competency of graduates to ensure the program's alignment with industry standards and expectations. Question 15. Topic: Use of technology in education. A nurse educator is looking to integrate technology into her clinical courses to enhance learning outcomes. Which strategy aligns best with evidence-based practices in technology integration? A. Incorporating virtual simulation activities that allow students to practice clinical skills in a safe, controlled environment. B. Using PowerPoint slides during lectures to reinforce key concepts without requiring interaction. C. Offering recorded lectures without any opportunities for students to engage with the material or each other. D. Providing students with online quizzes that only test their knowledge of terminology, with applying concepts to real-world scenarios. Answer: A. Incorporating virtual simulation activities that allow students to practice clinical skills in a safe, controlled environment. Explanation: Virtual simulation provides an immersive learning experience that allows students to apply theoretical knowledge to practical situations in a risk-free environment. This approach enhances critical thinking, clinical reasoning, and decision-making, which are core components of nursing education. Option B focuses on passive learning without promoting student engagement or active learning. Option C lacks interactivity and fails to facilitate deeper understanding or application of knowledge. Option D focuses solely on rote memorization, which does not foster critical thinking or real-world application. The use of virtual simulation aligns with contemporary teaching strategies as highlighted by the NLN, which emphasizes active learning and technology-enhanced education in nursing. Question 16. Topic: Adult learning principles. A nurse educator is designing a course on advanced pharmacology for adult learners. Given the principles of adult learning, what strategy should the educator prioritize in order to maximize engagement and learning outcomes? A. Lecturing for long periods of time to ensure comprehensive coverage of all topics. B. Creating opportunities for students to relate course content to their personal experiences and practice. C. Providing detailed textbook-based materials for students to study independently without any interactive elements. D. Focusing on theoretical knowledge rather than practical real-world applications. Answer: B. Creating opportunities for students to relate course content to their personal experiences and practice. Explanation: Adult learning theory, particularly andragogy, emphasizes the importance of relating new knowledge to personal experiences and practical applications. This approach promotes engagement, critical thinking, and retention by making the learning experience relevant and meaningful. Option A neglects the need for active learning and interaction, which is crucial for adult learners. Option C lacks interactivity, which is essential for adult learners who benefit from real-world problem-solving opportunities. Option D misses the key point of adult learning, which is the integration of theory with practice. The principles of adult learning, as outlined by Malcolm Knowles, advocate for an experiential, practical approach that leverages learners' previous knowledge. Question 17. Topic: Program evaluation. A nursing program has recently completed a curriculum review and is now seeking ways to assess its effectiveness. Which of the following methods is the most effective for assessing the program's overall impact on students' clinical competencies? A. Reviewing student grades and exam scores from the past semester. B. Conducting pre- and post-test assessment of clinical knowledge across several key topics. C. Gathering feedback from current students about course satisfaction. D. Collecting data on the number of students who pass the NCLEX exam. Answer: B. Conducting a pre- and post-test assessment of clinical knowledge across several key topics. Explanation: A pre- and post-test assessment measures the change in students' clinical knowledge over the course of the program, providing a direct measure of the program's impact on students' clinical competencies. This form of assessment is aligned with the principles of program evaluation and allows for evidence-based improvements. Option A only provides snapshot of academic performance but does not assess clinical competency development. Option C provides useful feedback but is more focused on course satisfaction rather than actual competency gains. Option D does not provide detailed assessment of the curriculum's effectiveness in developing clinical competencies. It only measures outcomes from standardized exam. Program evaluation literature emphasizes using both formative and summative assessments to measure learning outcomes across various competencies. Question 18. Scenario-based. Topic: Mentoring and advising Mr. Harris, a nursing student, has been performing well academically but has expressed concerns about his clinical performance. He feels unsure about his decision-making in high-stress situations and believes his clinical instructors are too busy to offer adequate feedback. As a mentor, what should you do to best support Mr. Harris? A. Advise Mr. Harris to work independently in clinical settings and seek feedback from his classmates. B. Encourage Mr. Harris to drop the clinical portion of the course and retake it next semester when he feels more confident. C. Suggest that Mr. Harris meet with his clinical instructors to discuss specific areas of improvement and seek additional feedback. D. Recommend that Mr. Harris change his specialty area as he may not be suited. Clinical practice in nursing. Answer. C. Suggest that Mr. Harris meet with his clinical instructors to discuss specific areas of improvement and seek additional feedback. Explanation. In the role of a mentor, it is crucial to help the student navigate challenges by offering practical solutions. Encouraging Mr. Harris to meet with his clinical instructors ensures that he receives specific, actionable feedback to improve his performance in high-stress situations. Option A may not provide adequate guidance as peer feedback is not a substitute for professional mentorship. Option B suggests avoiding the challenge instead of addressing the underlying issue, which could hinder Mr. Harris's development. Option D is premature and may discourage the student unnecessarily. Research in nursing education emphasizes the role of mentors in fostering clinical competence and confidence through constructive feedback and direct engagement with instructors. Question 19. Topic: Curriculum frameworks. A nurse educator is tasked with designing a competency-based curriculum for a new nursing program. Which approach should the educator prioritize to ensure the curriculum effectively assesses and develops competencies? A. Focus on ensuring that all students complete the same set of assignments regardless of their previous experience. B. Align the curriculum to specific competencies and allow students to progress at their own pace upon achieving mastery of each competency. C. Design a curriculum based primarily on theoretical knowledge with minimal emphasis on practical skills. D. Ensure that all course content is delivered in a single, intensive format rather than over multiple semesters. Answer. B. Align the curriculum to specific competencies and allow students to progress at their own pace upon achieving mastery of each competency. Explanation. Competency-based education (CBE) emphasizes mastery of specific competencies rather than time-based progression. This allows learners to progress according to their ability to demonstrate proficiency in each competency, leading to more personalized and effective learning. Option A fails to account for the diverse learning needs and prior knowledge of students. Option C neglects the importance of developing practical, hands-on skills alongside theoretical knowledge. Option D may be too condensed and does not allow students the necessary time to master each competency at their own pace. CBE aligns with current nursing education standards, ensuring that graduates meet the competencies required for safe, effective clinical practice. Question 20. Topic: Evaluation of learning outcomes. A nurse educator is tasked with evaluating a new nursing course's learning outcomes. What is the most critical component for determining whether the course has successfully met its learning objectives? A. Collecting subjective feedback from students about their satisfaction with the course materials. B. Analyzing the alignment between course assessments and the defined learning outcomes. C. Comparing the course's final exam scores to those of similar courses offered at other institutions. D. Reviewing the syllabus to ensure that all content has been covered. Answer. B. Analyzing the alignment between course assessments and the defined learning outcomes. Explanation. The primary goal of evaluating learning outcomes is to ensure that the assessments accurately measure whether students have achieved the defined learning objectives. Alignment between assessments and learning outcomes ensures that the evaluation process is valid and reliable. Option A may provide useful feedback but does not assess whether students have met the actual learning objectives. Option C focuses on external comparisons rather than the internal alignment of assessments with outcomes. Option D reviews content coverage, but it does not guarantee that students have mastered the intended learning outcomes. Effective course evaluation requires a systematic process to assess whether learners have met the expected outcomes as outlined in accreditation standards. Question 21. Topic: Test construction and analysis. A nurse educator is designing a new multiple choice exam for an advanced nursing course. Which of the following strategies will ensure the test items are both reliable and valid? A. Randomly selecting questions from various textbooks without ensuring they align with the course objectives. B. Including a wide range of question types, such as true, false, and fill in the blank alongside multiple choice questions. C. Ensuring that each test item clearly measures a specific learning outcome and follows a structured blueprint. D. Designing questions that require students to memorize specific facts without asking them to apply critical. Correct answer, C. Ensuring that each test item clearly measures a specific learning outcome and follows a structured blueprint. Explanation. In order to ensure that a test is both reliable and valid, each item must be aligned with the defined learning outcomes and assessed using a structured blueprint. This ensures that the test measures the knowledge, skills, and competencies expected from the students. Option A does not ensure that the questions are relevant to the course content or objectives, undermining the validity of the test. Option B may dilute the focus on multiple choice questions, which are a widely accepted format for assessing knowledge and critical thinking depending on the subject. Option D promotes rote memorization, which is less effective than evaluating students' ability to apply knowledge in clinical or practical contexts. Educational best practices and accreditation standards require alignment between assessments and learning outcomes to ensure both fairness and rigor. Question 22. Topic: Feedback mechanisms. A nurse educator is reviewing student performance after a clinical rotation. Some students have expressed concerns about the feedback being too vague to improve their practice. What action should the nurse educator take to enhance the effectiveness of their feedback? A. Provide feedback only on the final performance to ensure students understand the end result of their efforts. B. Use descriptive, specific, and actionable feedback that addresses strengths and areas for improvement in clinical skills. C. Focus solely on the clinical tasks that were performed incorrectly and avoid discussing areas of strength. D. Deliver feedback in a group setting to allow students to learn from each other's experiences. Answer. B. Use descriptive, specific, and actionable feedback that addresses strengths and areas for improvement in clinical skills. Explanation. Effective feedback is specific, descriptive, and actionable as it guides students on how to improve their clinical skills. It is crucial to highlight both strengths and areas for growth to foster a positive learning environment and enhance skill development. Option A provides feedback only at the end, which does not allow for timely corrections and growth throughout the process. Option C is overly negative, focusing only on mistakes and failing to provide positive reinforcement or actionable guidance. Option D may make feedback less personal and relevant to each student's specific needs, potentially hindering individual progress. Research supports the idea that formative, detailed feedback is essential for promoting learning and performance in clinical settings. Question 23. Scenario-based. Topic: Cultural competency. Ms. Patel is a nurse educator who is teaching a class of nursing students with diverse cultural backgrounds. One student, Maria, is struggling to understand some course materials due to language barriers, which are affecting her ability to perform well in clinical assessments. As Ms. Patel, what should she do to support Maria's learning? A. Advise Maria to use translation software on her own without further assistance from the educator. B. Offer to provide Maria with additional reading materials in her native language and arrange for peer tutor to assist her during clinical assessments. C. Recommend that Maria consider withdrawing from the course and re-enrolling after improving her language skills. D. Encourage Maria to attend office hours but limit assistance to clarify vocabulary rather than addressing the underlying language barrier. Answer. B. Offer to provide Maria with additional reading materials in her native language and arrange for a peer tutor to assist her during clinical assessments. Explanation. Cultural competency in nursing education involves recognizing and addressing barriers such as language differences that may impact a student's learning experience. Offering targeted support, such as translated materials and peer tutoring, ensures that students from diverse backgrounds have the opportunity to succeed without feeling marginalized. Option A provides insufficient support, as translation software may not be enough to bridge the learning gap in clinical settings. Option C is premature and unhelpful, as the student is not being given the opportunity to overcome the challenge with appropriate support. Option D provides limited support by only focusing on vocabulary, ignoring broader language comprehension issues that could affect clinical practice. Addressing language barriers through targeted interventions aligns with inclusive teaching strategies and fosters equitable learning environments. Question 24. Topic: Program evaluation. A nurse educator is reviewing the effectiveness of a newly implemented interprofessional education IPE module that was added to the curriculum. Which of the following approaches would best assess the impact of IPE on students' collaborative skills? A. Analyzing student grades in IPE-related courses and comparing them to grades in traditional nursing courses. B. Conducting surveys to assess students' self-reported perceptions of their collaboration skills before and after the module. C. Reviewing faculty members' feedback on student performance during clinical rotations and team-based activities. D. Observing students' performance during a simulated team-based clinical scenario and assessing ability to collaborate effectively. Answer: D. Observing students' performance during a simulated team-based clinical scenario and assessing their ability to collaborate effectively. Explanation: the most effective way to assess collaborative skills is through direct observation in a real or simulated team-based environment. This allows educators to evaluate how well students apply the concepts of interprofessional collaboration in practice. Option A may not accurately capture the development of collaboration skills, as grades in traditional courses do not necessarily reflect teamwork abilities. Option B assesses self-perception but does not offer an objective measure of actual collaboration skills. Option C provides useful feedback but may not offer a comprehensive assessment of the student's collaborative abilities in a realistic context. Simulated clinical scenarios are widely regarded as an effective method for assessing teamwork and collaborative competencies in nursing education. Question 25. Topic: Mentoring and advising. A nurse educator has been assigned to mentor a new cohort of nursing students. One student, Kelly, has expressed frustration with the clinical rotation, feeling that the learning environment is too stressful and overwhelming. As Kelly's mentor, which action would be most beneficial in addressing her concerns? A. Advise Kelly to avoid speaking up during clinical debriefings to avoid appearing overwhelmed. B. Encourage Kelly to connect with her peers for support and share her frustrations with them. C. Schedule one-on-one meeting with Kelly to discuss her concerns, provide reassurance, and develop strategy for coping with stress. D. Suggest that Kelly change her clinical rotation to less demanding unit to reduce her stress levels. Answer: C. Schedule a one-on-one meeting with Kelly to discuss her concerns, provide reassurance, and develop a strategy for coping with stress. Explanation: effective mentoring involves offering personalized support and helping the student navigate challenges in a constructive manner. By meeting one-on-one with Kelly, the mentor can offer reassurance, understand the root causes of stress, and collaborate on strategies to help her succeed in the environment. Option A encourages avoidance and does not address the underlying issue of stress, which could lead to further disengagement. Option B may help Kelly find peer support, but it does not provide the professional guidance necessary to cope with the stress. Option D is not a solution to stress management, as it does not help Kelly build resilience or address the stresses in a meaningful way. Mentors play a critical role in providing emotional support and guiding students through stressful situations, ensuring they have the resources to manage challenges and thrive in clinical settings. Question 26. Topic: Curriculum design and development. A nurse educator is in the process of designing a new curriculum for an advanced nursing course. The educator is considering how to integrate evidence-based practice into the course objectives and content. Which of the following strategies will best achieve this goal? A. Teaching students about evidence-based practice in a single lecture without follow-up activities or application to clinical scenarios. B. Incorporating evidence-based practice into all aspects of the curriculum, including assignments, case studies, and clinical placements with a focus on real-world applications. C. Emphasizing theoretical knowledge of evidence-based practice without requiring students to apply it to patient care situations. D. Focusing solely on traditional nursing practices and incorporating minimal evidence-based practice content into the curriculum. Answer: B. Incorporating evidence-based practice into all aspects of the curriculum, including assignments, case studies, and clinical placements with a focus on real-world applications. Explanation: integrating evidence-based practice EP throughout the entire curriculum is essential to ensuring that students not only learn about EP but also apply it in real-world settings. This approach ensures that students gain practical experience in evidence to make clinical decisions and improve patient care. Option A limits EP to a lecture and does not give students the opportunity to practice its application, reducing its impact on clinical decision-making. Option C emphasizes theoretical knowledge without practice, which will not prepare students to effectively use EP in clinical settings. Option D minimizes the role of EP, which may hinder students from developing the skills necessary to practice nursing in an evidence-based manner. Integrating EP across various teaching methods and clinical experiences promotes critical thinking and helps students understand its real-world implications in nursing care. Question 27. Topic: Leadership in nursing education. A nurse educator is tasked with leading a change initiative in a nursing program aimed at increasing student engagement in online learning environments. Which leadership approach will be most effective in guiding this change? A. Using a top-down approach by mandating changes without seeking input or feedback from faculty or students. B. Encouraging open dialogue with faculty and students, fostering a collaborative environment and involving them in the decision-making process for change. C. Enforcing strict rules on how online learning should be conducted without considering individual teaching styles or student needs. D. Relying solely on technology, digital tools to engage students, without addressing any underlying issues in teaching practices or curriculum design. Answer: B. Encouraging open dialogue with faculty and students, fostering a collaborative environment and involving them in the decision-making process for change. Explanation: Effective leadership in nursing education involves collaboration, communication, and shared decision-making. When a nurse educator encourages input from both faculty and students, they help foster a sense of ownership and buy-in, which increases the likelihood of change. Option A is an autocratic approach that may lead to resistance and disengagement from those affected by the changes. Option C enforces a rigid approach, limiting the flexibility needed for adapting teaching practices and addressing the diverse needs of students. Option D focuses too narrowly on technology and overlooks the importance of pedagogy and teaching methods in creating an engaging learning environment. Leadership that values collaboration and inclusivity helps create sustainable change and encourages both faculty and students to actively participate in shaping the learning experience. Question 20. Topic: Professional development. A nurse educator is seeking to enhance their professional development and stay current with nursing trends. Which of the following strategies would be most effective for the educator to pursue ongoing learning and growth in the field? A. Relying solely on in-service training sessions provided by the institution to stay updated on nursing trends. B. Participating in professional conferences, pursuing continuing education courses, and engaging in scholarly research and publications. C. Focusing only on teaching courses that the educator is already highly familiar with, avoiding the need for further development. D. Waiting for institutional mandates or requirements, professional development rather than seeking opportunities independently. Answer: B. Participating in professional conferences, pursuing continuing education courses, and engaging in scholarly research and publications. Explanation: Ongoing professional development is essential for nurse educators to remain knowledgeable, up-to-date, and effective in their teaching practices. Attending professional conferences, pursuing continuing education, and engaging in scholarly research help educators stay informed about current innovations and best practices in nursing education. Option A limits professional development to the institution's offerings, which may not address all areas of interest or emerging trends in the field. Option C is counterproductive, as stagnation in teaching can limit the educator's ability to adapt to new challenges and innovations in nursing education. Option D is reactive rather than proactive and may result in missed opportunities for growth and leadership in the field. Engaging in a variety of professional development activities allows nurse educators to enhance their skills and remain leaders in the nursing education community. Question 29. Topic: Assessment and evaluation. The nurse educator is evaluating the effectiveness of a newly implemented formative assessment in the classroom. Which of the following actions will best support the ongoing improvement of this assessment tool? A. Administer the formative assessment once per semester without collecting any feedback from students or faculty. B. Collect feedback from students regarding the clarity and usefulness of the assessment and adjust it as needed based on their input. C. Use the same assessment format for every course without considering the specific needs of the students or the course objectives. D. Focus only on summative assessments and disregard the role of form assessments in monitoring ongoing student progress. Answer: B. Collect feedback from students regarding the clarity and usefulness of the assessment and adjust it as needed based on their input. Explanation: Formative assessments are intended to provide ongoing feedback to both students and educators, helping to monitor and improve learning. Collecting feedback from students ensures that the assessment is effective and meets their needs, allowing for improvements in both the tool and the learning experience. Option A does not allow for the evaluation or refinement of the assessment, which may lead to ineffective tools that do not meet the needs of students. Option C ignores the importance of tailoring assessments to the specific course content and student learning goals, limiting their effectiveness. Option D overlooks the value of formative assessments, which play a critical role in guiding student progress and shaping future learning opportunities. Feedback mechanisms are integral to enhancing formative assessments and ensuring they support student learning throughout the course. Question 30. Topic: Mentoring and advising. A nurse educator is mentoring a student who has expressed concerns about balancing the academic workload with personal responsibilities. Which of the following strategies should the mentor use to support the student's success? A. Advise the student to reduce the number of classes they are taking to minimize stress, even if it means delaying graduation. B. Help the student prioritize tasks, develop time management plan, and explore resources available for academic and personal support. C. Suggest that the student stop attending clinical rotations temporarily to focus solely on coursework. D. Encourage the student to ignore personal responsibilities and focus entirely on academics for the duration of the program. Answer: B. Help the student prioritize tasks, develop a time management plan, and explore resources available for academic and personal support. Explanation: Mentoring students involves providing guidance and support that helps them manage their academic and personal responsibilities. A time management plan, coupled with resources for academic and personal support, empowers the student to succeed without feeling overwhelmed. Option A may be helpful in certain situations but could unnecessarily delay the student's graduation and future career. Option C suggests drastic step that might harm the student's clinical education and is not balanced approach. Option D encourages unhealthy work habits and could lead to burnout, hindering both academic and personal well-being. Effective mentorship supports students in achieving balance that promotes academic success while addressing personal needs and responsibilities.